Alright, so this presentation is going to be able to be used for athletes and coaches and even parents when you're trying to describe a concussion. So to begin this presentation, I want you to imagine a scenario in which you think a concussion can occur. So imagine a wide receiver lined up on the offense, ball snapped, and he's running his route. He cuts in towards the middle of the field and catches a pass, and when he's turning to run up the field, he immediately gets hit by a defensive back, and the defensive back led with his head instead of using proper tackling mechanics, and you have an immediate helmet-to-helmet contact. This is a prime concussion scenario, and the definition of a concussion is a direct or indirect blow to the brain, causing it to pretty much shake inside the skull, thus causing it to have altered function. And because of this altered function, you could experience some signs and symptoms. So there are many signs and symptoms that you can experience due to a concussion, and 10 of them that are really basic and easy to remember are going to be headaches, nausea and vomiting, dizziness, irritability. You could be sensitive to light. You could be feeling more emotional, like sad or depressed. You could have lack of sleep, although you might not always have lack of sleep. It might actually be easier for you to fall asleep. And you could also be experiencing balance problems. So when it comes to these signs and symptoms, you're going to want to grade them on a scale of 0 to 6. 0 being not, like, you don't have the symptom at all, like it's not there. And 6 being, like, it's intense, like you have it, you know it's there, it's awful. All of these are going to be, like, referred to you in a question format when asked. So it's going to be like, do you have a concussion? Do you have nausea? Do you have vomiting? Are you sensitive to light? In that kind of format, just so it's a little bit easier to understand. Now, when you're being evaluated for a concussion, you are going to be asked history questions. So like the signs and symptom questions, you're going to be asked those. You're going to be asked if you have neck pain, and you're also going to be asked if you have ever had a concussion before. So when you're going to be observed for a concussion, your eyes are going to be looked at to see if the pupils are the same size, to see if they're drifting. You're going to check and see eye movement to see if you have nystagmus, which is pretty much your eye twitches or it stutters when it's moving. Now you're also going to use a light to determine if the pupils are reacting the same. And you're also going to be just observing for any bruising along the skull, any swelling, anything that could indicate something other than a concussion like a fracture. Now, when you're also being evaluated, I'm also going to be feeling your skull just in case you have any fractures or anything. So you're going to want to feel the jaw, the nose, the front of the skull, the sides, and the back of the skull. Now, if you're experiencing neck pain as well, I'm going to be feeling what is essentially called the spinal processes and the transverse processes of the C1 through 7 vertebrae, which are the vertebrae that connect to the base of your skull and go down. There's also going to be certain muscles that I'm going to be feeling as well, just to see if they're tight, because the whiplash effect from getting hit in the head can cause the muscles to spasm. So there's a muscle called the sternocleidomastoid, which is the muscle that pokes out when you turn your head to the side. You could also have the levator scapula, which pretty much just attaches to the base of the back of your skull, and the upper traps, which is, everybody knows where the upper traps are. Those are the big neck muscles. Now, a test that you can do to see if a patient has a concussion is called the SCAT-3. And pretty much this is just a series of tests that you can do to see if a patient or athlete has a concussion. So it's going to have the signs and symptoms, balance tests. It's going to have memorization of words and numbers, all of that just to see if you have a concussion. Now, if you have the signs and symptoms of a concussion, you are not going to go back in until you are symptom-free, pretty much. But if you're in the middle of a game and you get hit and you go down and you have the signs and symptoms of a concussion, you're not going to go back in. And the plan that we have with our physician is that if a concussion is suspected, I'm going to refer you to them so he can make the final diagnosis, if you would. So for treatment, it's pretty simple. All you're going to want to do is rest. You're going to want to physically rest, so no working out, no running, any of that. You're just going to want to physically rest and mentally rest. So don't watch TV, don't do homework, don't do anything that stresses you out mentally, anything that causes you to think really hard. Limit your screen time on your phone. Just rest your brain. Especially if any of these activities cause your symptoms to increase, you want to stop doing it if your symptoms are increasing with this type of activity. Now, when we're going to return you to play after a concussion, the first day of your return to play protocol is going to be the day that you are symptom-free. You have no signs or symptoms. You're feeling pretty good. That's going to be the first day of this series of steps to get you back to playing. So, first day is symptom-free. The second day is going to be light aerobic activity, so like walking or riding on a stationary bike. And you're going to do this for 15 to 20 minutes. Light activity, get the heart rate going. It's going to check and see if the symptoms increase or if you even have symptoms return at all. If you don't have them return, you can move on to the next day. And if they return, then you're just going to go back to resting. And that's pretty much going to be the same pattern for all of these. So after the light aerobic exercise, you're going to move on to more sport-specific activity. So say if you're a football player, you'll be doing cone activities, running and catching passes, all of that. And you'll be doing that for about 30 to 40 minutes, just getting the heart rate going again. And after that, symptom-free still, you move on to non-contact drills with the team. You can do pretty much like the name suggests. You can do any activity that is non-contact. And you can do that for all of practice as long as there is no contact. Now, if you're symptom-free still, you can move on to the next day, which is full contact practice. And if you're symptom-free after that, you're done with the return to play protocol and you're cleared to play again. After, you'll probably have to go back and see the physician again just to make sure, but you can essentially return to play and your concussion's gone. So, concussions are a very serious injury, but with the right precautions and the right steps, they can be managed and avoided. Thank you.